saving lives in the state of Washington. We're making this investment today because we know every life in the state of Washington has value. So I'm excited to announce these strong incentives that will bring the potential to save thousands of lives on top of everybody else's agenda in their individual lives. The vaccine is a shot to provide health and protection to you, to your family, and to your community. So we are providing a shot of a lifetime in this incentive package. It will be administered through our Washington State Lottery system. The state is going to do 5 weekly drawings for vaccinated Washingtonians. It'll be using the names of the people who have had their information entered into our Department of Health database after they got vaccinated. The first 4 weekly lottery drawings will include a $250,000 prize each week. The 5th and final lottery will be for an award of $1 million. Marcus Glassford, director of our Washington State Lottery, will provide more detail on how this is going to be administered. Now, on top of that, there are numerous other parts of this incentive package. Washington State Parks will give away 80 gift cards for 1 week of free camping worth $250 each to the winners. The Department of Fish and Wildlife will provide 80 gift certificates worth $100 each for fishing and hunting licenses. We'll also raffle off 400 Discover cards, which will allow access to recreation and state parks. We're also providing $1 million for higher education tuition costs. We're providing funding for public 4-year universities and 2-year community and technical colleges to run their own drawing for free tuition and expensive for vaccinated students. So the colleges themselves will administer that program. The state will also be offering 30 prizes of 1 year of tuition college credits to 12 and 17-year-olds through the Guaranteed Education Tuition GET program. We have sports incentives as well. Our partners in our state's professional sports world are also stepping up for the cause, which we appreciate. Tickets to see the Mariners, the Storm, Sounders, the OL Reign, concert at the Kraken's new stadium, and even club seats at the Seahawk game will be part of this incentive program. And due to the generosity and community spirit of several Washington State businesses, we will also be able to offer additional prizes for those who get their COVID vaccination. It includes 300 Xboxes from Microsoft, airline tickets from Alaska Airlines, 40 Echo Dots from Amazon, and prizes from Nintendo and Google. In addition, our State Department of Commerce will be active. It's partnering with the Association of Washington Businesses, and we will be purchasing $1 million worth of gift cards that will be essentially can be used at local businesses that will be given through local Chamber of Commerce's at vaccine locations. The State Department of Health will also have $500,000 in gift cards to give away over the summer, and they'll provide these gift cards through the Care a Van program, which brings mobile clinics out to where people reside and gather. The gift cards will be for different kinds of retail gatherings, from groceries to fishing gear to topsoil. We're also looking at other programs. I think you get the picture. This is a tremendous statewide effort with multiple parts of this incentive package. It includes a lot of hard work by countless people who are pitching in, especially the lottery folks, of course. And again, these are open to anyone in our state, regardless of citizenship status, but you must be a Washington resident. Of course, you know there are certain exemptions, and you can find those on the Department and Lottery's website. There are also some federal vaccinations that have not been captured yet in our state data system, and we're working with the federal government to allow an opt-in provision for those individuals. We hope that can be made to work. I want to thank all these organizations involved in this incentive package. I want to thank the businesses for stepping up to saving lives and getting this COVID vaccine. I now would like to introduce our Washington Lottery Director, Marcus Glasper, to talk about this incentive program in more detail. Marcus.
Thank you, Governor. Good afternoon, everyone, and happy Pride Month. My name is Marcus Glasper, Director of Washington's Lottery, and I'm honored to be here with Governor Inslee on this exciting day. Governor Inslee reached out to our agency recently asking for our support to administer the Shot of a Lifetime promotion, and we are more than happy to join forces with the Governor's Office and the Department of Health to do so. The Governor has already provided you with an overview of the promotion, and now I'd just like to share a bit more detail on how the process will work. So every eligible adult and youth resident of the state who has received at least one dose of a COVID-19 vaccine that was recorded in the state's immunization information system will be assigned a number by the Department of Health. This means you do not have to go anywhere or do anything except get at least one vaccine dose if you have not already done so to be entered into these drawings. Then, over the course of the next 4 weeks, starting Tuesday, June 8th, we will be using the lottery's random number generating system to conduct 2 drawings every Tuesday. One drawing for those Washingtonians 18 and older, and one focused on those ages 12 to 17, using the range of numbers provided by the Department of Health. The final grand prize drawing for $1 million that the Governor spoke of will be held on July 13th. As the Governor mentioned, there will be a total of $2 million in cash prizes given away as part of this Shot of a Lifetime promotion, as well as the youth-focused drawings that will provide GET units, or the Guaranteed Education Tuition units. Additionally, there are many other prizes being provided by private companies and public agencies alike, and we are grateful for their participation. Winners of those prizes will also be drawn each Tuesday as well. Once we have identified the winning numbers for each drawing, we will communicate with the Department of Health, who will then match each number to the name of the individual. The presumptive winner will then be contacted by Washington's Lottery or one of our employees and informed of how to collect their prize. All of the promotion's rules and eligibilities will be available on our website at wallottery.com. Again, Washington's Lottery is proud to play a role in Governor Inslee's effort to help ensure our state's residents are healthy and protected as we continue to move toward ending the pandemic and reopening our economy. And with that, I'm going to hand it back over to Governor Inslee.
Marcus, for designing this program in quick order. We appreciate your leadership and your whole team on this. I now would like to hear some comments from Dr. Shaw. Dr. Shaw.
Thank you, Governor. Thank you, Marcus, for your kind words, and it's great for Department of Health to be a part of this. Governor, I just want to say thank you to you. As you know, tomorrow marks the 500-day mark since we started responding to COVID-19 in our state, and we have all thought since the beginning of this difficult process, how can we see this pandemic end? And that's what COVID-19 vaccines represent for all of us in the state of Washington. We have made tremendous progress to date in vaccinating Washingtonians. We have 3.9 million, just shy of 4 million people with at least one dose of COVID-19 vaccine. We are truly seeing light at the end of the tunnel. But I'm excited today, Governor, to join you and Marcus and our lottery partners on this new effort to drive more vaccination. We hope this will encourage more people to get this life-saving vaccine. We know that the efforts to date have been successful, but we recognize that the hard work remains ahead of us. We want to encourage everyone to get vaccinated. If you are eligible, if there is vaccine nearby you, or even if it's not nearby you, we want you to do everything you can to get vaccinated. And today's efforts really promote the fact that at the end of the day, these vaccines are life-saving, but also we want to do everything we can in Washington to encourage people to get vaccinated. We certainly know that vaccines also represent protection. We know that those who are vaccinated are protected from this awful disease. We also recognize that those who are not vaccinated remain unprotected. And that's why if you are still thinking about it, you're on the fence, or you haven't just quite made it down to the local pharmacy or gotten your shot some other way, we want to make sure you do everything you can to go ahead and get vaccinated today. And what the governor just announced and what our lottery partners just announced and what all of us are working together is to really encourage all Washingtonians to get vaccinated. So with that, Governor, thank you so much for this. We do believe that this is going to be a shot in the arm, if you will, no pun intended, for us to really see vaccination increases across Washington, and we're looking forward to be a part of that.
Thank you, Dr. Shaw. And I should note that our efforts are not limited to this incentive package. We're doing everything we can to make this vaccine as accessible to people as possible, including efforts to have mobile vans to go out to where people are. So an incentive is one part of this package, but our accessibility efforts are continuing as well. I do want to, the fact that this can save your life should be a pretty good motivation. But there's another motivation for this, and that is that if we increase our vaccination rates, we could open up our economy before June 30th if we can get to 70% of people over the age of 16 who've had a shot, or at least a first shot. Today, we're at 63% of those over the age of 16 who've initiated their vaccines. We would like to get to that as soon as possible. So there's a motivation in this regard to reopen up our economy as well. So at the moment, unfortunately, though, that means that there are over 2 million Washingtonians who still are unprotected by a vaccine against this deadly disease. It's 2.3 million people have not initiated their vaccine yet. And we want to do everything we can to help them and to have them top of mind to actually start this vaccination process. And we hope that that can be effective. Now, why are we doing this? It's because we know it works. It's working well in other states. This is a very, very common sense investment to save lives. We're still losing a dozen lives or so a day in the state of Washington. We know we can do better. And we know people are busy. We know they have a lot of things in life. But if this can have them think just a little more often about getting that vaccine and saving lives, that's a great investment for the state of Washington, and we're happy to make it. Now, as far as where we are today, let me just give you a feeling where Washington is relative to other states. I'd like to show you a graph that shows where we are as far as percentage of Washingtonians who are over the age of 18 who've had at least one COVID vaccine. You'll see the yellow line where we are in Washington. We're in about the top third as far as the percentage of people in that age category who started their vaccination. Now, there's good news there is that we're, in the top third or so, but of course we always want to be first when it comes to saving life. And it shows that we ought to be capable of increasing the percentage of Washingtonians who are having this shot at life. So good news there, we're making progress, but we've got more progress to make. Now, I want to note, too, we are already allowing additional activities with fewer restrictions and increasing capacity for groups of fully vaccinated people. It is an advantage to be vaccinated not only to save one's life, but to have access to more opportunities. Spectator events, such as indoor and outdoor sports, will no longer have limits on the number of vaccinated attendees. So if you're vaccinated, there will not be limits on the size, if you will, of your group. Conferences and live performances, weddings and funeral receptions can be at full capacity if the people who are attending, in fact, are vaccinated. And of course, you can find access to the vaccine locator to check out the easiest place for you to get access to the vaccine. So getting these jabs means more activity in one's life as well as saving life as well. I'd also like to address a recent proclamation about masks. Employers in this state are always required to operate a place of business that is free from hazards and that can injure or cause death. And over the last year, thousands of Washingtonians have seen for themselves that COVID can be a fatal disease. So our proclamation keeps the mask mandate, but makes exceptions on the job for those who tell their employer that they are fully vaccinated. This proclamation gives employers the choice of adopting this new opportunity in the mask mandate, or just keeping the status quo by allowing a universal mask requirement in their places of business. So it is the employer's choice. But if they do choose to give a mask-less opportunity for their employees, they now are free to do so for those who are fully vaccinated. And it is important to note, too, the law does not prevent employers from inquiring as to the vaccination status of their employees. It's an important point. So this is a choice that is workable, it's reasonable, and the one will help us to do more activities even during this pandemic. Before I take questions, I'd like to say that getting a vaccine is not only a choice to be healthy, it's more than that. It's a right. It seems to me health ought to be your right. Health is essential to our freedom, and our getting a vaccine affects other people's health as well. And I hope people can think about it in those terms. The pandemic has threatened our right to live healthy lives, and the choices we make, like getting a vaccine, is how we preserve that strength in our community. The vaccine is the greatest tool against this virus, and this virus is still very, very active. People who are not vaccinated are still at considerable risk. But the vaccine is already saving thousands of lives in our state and across the world. It's safe and it's effective. And the truth about the science is that it's widely available. That truth is widely available. And I do encourage anyone who has any questions about this vaccine, ask your medical provider. Get it straight from the horse's mouth on this, and they'll tell you what the real truth is about this vaccine. Choices do have consequences, and we'd like to now, with this incentive package, give people a little more thinking about making the choice that's going to keep the community healthy in our blessed state. So with that, I'd be happy to stand for questions, as well as Dr. Shaw and Marcus. And we also have Lacey Fehrenbach and Nick Struley, who are here to answer any questions as well.
All right, up first, we'll go to Rachel LaCourte with AP. Go ahead, Rachel.
Hi, for either the governor or Director Glasper, how soon after the drawings will the winners be notified, and will their names be made public each week? And then also, can you talk about how much of the state part of the incentive program is funded by state dollars versus the federal COVID money the state is receiving?
Marcus, you want to answer that?
Sure. Thank you for that question, Rachel. So after each drawing, my team they are prepared to contact the winners. The winners will have 72 hours with which to respond to our contact, and that is to claim their prize. If they do not contact us within 72 hours, we will move on to alternate presumptive winners. And in terms of the mixture of the funding to source, I think we're still working those details out with the Office of Financial Management.
All right, up next, we'll go to Joe Sullivan with the Seattle Times. Go ahead, Joe.
Hi, a question for the health secretary. I believe Washington is sort of in the top 2 or 5 states in terms of cases per 100,000 right now in the nation, even though things are going down everywhere. To what do you attribute that, and what sort of trends or trouble spots or situations are you seeing right now in COVID activity?
Well, thanks for that question. I think the first and foremost thing that we have to remember is that we are doing very well in Washington across the spectrum. We are seeing pockets and clusters that are occurring in certain parts of the state, which I think it really, again, goes back to what the governor said earlier, that those who are protected because of vaccines are really in a great place. Unfortunately, those who are not vaccinated really continue to contribute to the infections that are happening within our state. And we talked about this yesterday during our Department of Health briefing, which is very much that if you are unvaccinated, you have a markedly higher risk of hospitalization than if you are vaccinated. So I think overall it's the combination of just reminding everybody of how important it is for vaccinations, but we also have to recognize those additional behaviors. And I've said this many times. I'm a parent. My wife and I are parents of 3 children, 11, 7, and 4. None of them are eligible to be vaccinated. We have to champion those behaviors to make sure that they're also protected. It's very hard for parents right now because they may have been vaccinated, but their kids or those loved ones around them may not be vaccinated for some reason, perhaps a medical condition or because of an age eligibility like our children. And so we have to really continue with those behaviors. We need to do everything we can to continue to encourage people to get vaccinated. But in the meantime, we also have to remember that we are still in the midst of a pandemic. And ultimately, I think that is the key message here. As far as the rates overall, I actually think we're doing very well. But I will say that you are going to see some increases and even some potential decreases over time with one state versus another state. And I think you have to really take the summation of what's happening across the entirety of the spectrum as well as over time. So I hope that answers your question. And certainly, Governor, if you wanted, I don't know if you had anything else that you wanted to add to the message as well.
Well, the important point is we're still doing very, very well relative to other states in our rate of death. We're one of the least rates of fatality in our state. We're very pleased about that. And as we've talked about many times, the reason is because we've been smart and we've listened to the science and we've masked up and we've socially distanced, and that's why our rates have been very, very low relative to other states. But right now, we're a little bit of a victim of our own success because we had such low rates of infection and death. We had less people who acquired natural immunity early in the pandemic. So in the early and the middle part of this pandemic, we had states seeing thousands and thousands of people losing their lives and tens of thousands being infected, and the people who survived got natural immunity. We had those people didn't get sick, which was great, but they also did not acquire natural immunity. So it is not surprising that one of the most successful states has a relatively degree high of infection right now. Now, fortunately, that's not ending up with the tens of thousands of losses that other states have had. But in any event, it just shows you if you follow science, good things will happen, and that's what we intend to keep on doing.
All right. Up next, we'll go to Laurel Demkovic with the spokesman review. Go ahead, Laurel.
Hi, Governor. I have 2 questions. The first is just kind of a clarification. So as soon as people get their first shot, they're automatically eligible, correct? So if someone were to get their first shot tomorrow, they'll be eligible for next week's drawing. So that's my first question. And then secondly, you mentioned the 70% goal. If we don't end up hitting that by June 30th, are we still planning to reopen? And is there any sort of plan yet for what that looks like?
We would still plan to open on June 30th. We'd like to do it earlier, and the more people get vaccinated, the better shot we have at that. Marcus, I want to make sure that the first shot qualifies you. Am I correct on that?
Yes, Governor, the first shot does qualify you. However, the drawing is based on who is recorded in the immunization information system. And so it really is going to depend on the time. Sometimes the provider may not get it right away. So I don't know if Lacey has anything she wants to add to that, but it's going to be who is recorded in the database.
So the earlier, the better. Rush on down to that vaccinator this afternoon.
And yeah, I can quickly add, most providers report quickly to us. They do have 72 hours to report per CDC guidance.
All right. Up next, we'll go to Debbie Cockrell with the Tacoma News Tribune. Sorry.
Hi. Governor, when will the drawings for the game systems and smart speakers, how will those be handled?
Marcus, you want to address that? I don't know what he can add, but anything you can add to this, Marcus?
Can you repeat the question, please?
Yes. How will the drawings for the game systems and smart speakers be handled?
Oh, the same way we use our random number generator system, and we will pull a range of numbers that equal to the total number of prizes that are being awarded in that particular week. and then prizes will be awarded based on the value of the prize. And so if it is a Amazon Dot or an Xbox, once the individual claims that prize, the Washington's Lottery will have that prize shipped to the winner.
All right. Up next, we'll go to Joey Thompson with the Everett Herald. Go ahead, Joey.
Hi, a question about the 70% mark. Are the federal pharmacy program vaccinations included in that number? Same with the FEMA site, or are they sort of still excluded from the DOH's database? And then looking at the 18, plus versus 16 plus, what's the thought process on going with 16-year-olds to hit 70% as opposed to just 18-year-olds?
Yeah, the 70% for our purposes are the things that are in our database. So as you know, the things that come through Department of Defense and Veterans are not in our database because they are not subject to individual identifiable people. So that decision will be based on the information available in our database. As far as 16, that was chosen because that was the folks who were eligible when we set that target. It was 16 and up, as I recall. Lacey, did you have anything to add to that?
Yeah, Governor, this is Umair. That is correct. We when we went forth with that goal, it was 16 plus, and we wanted to make sure that we were consistent with that goal throughout, and that's why we've been using that 16 plus number. Lacey, you may want to answer the pharmacy question that was also asked.
Yes. So the FEMA site that was in Yakima is actually included in our database. Those are reported to us. And the majority of the pharmacy programs are also in our database.
All right. Up next, we'll go to Drew Mickelson with King 5. Go ahead, Drew.
Good afternoon, Governor. I'd like to change gears just a little bit. Fawn Sharp with the National Congress of American Indians was very harsh regarding your veto of the Climate Commitment Act. I know you heard the words shameless betrayal. She said you're a snake. She said Donald Trump was right. She fears what your veto will mean for the future relationship between you and the state and the tribes, and also the environment on tribal lands. How do you respond to that reaction to your veto?
Well, we have had a tremendous working relationship between the state of Washington and these sovereign tribes. I take pride in that because our consultation process with the tribes has been probably as good or better than any other state in the United States. And I'm very confident that will continue. I believe that it will, in part because I had a discussion with at least a dozen other tribal chairs in the last week. And I'm very confident after those discussions that we will have a very good, robust way to develop a specific protocol for consultation, which is very important. I'm honored that Chairman Frank of the Nisqually Nation, Chairman Allen of the Jamestown Sklallam, Chairman Edwards of the Swinomish, and Chair Peters of the Squaxin have already agreed to sort of work in the working group that will present some ideas to the larger group of tribal nations so that we can come up with a good consultation process. Now, my veto was entirely necessary, unfortunately, because the way that language was drafted, it would have given every single tribe in the state of Washington the ability to cancel or terminate every single project in the state of Washington, no matter where it was, and no matter what reason that would have to be given, because there was no due process in the system. It would also, and several tribal members articulated this to me, unfortunately would allow one tribe to cancel another tribe's project. I know tribes don't like that idea. So we have to do a little more work to define a consultation process that works for everyone. And I'm very confident we can do that. In my conversations with the real tribal chairs, the person you just mentioned is not a tribal chair. The real tribal chairs that I spoke to have made it clear to me that we are on the right track to have a good outcome here that's going to require some more work, but I'm confident in the ability to do that.
All right, up next, we'll go to Charles Featherstone with the Columbia Basin Herald. Go ahead, Charles.
Good afternoon, Governor.
Good afternoon.
I have a question in regards to the L&I rules regarding vaccinations and mask wearing, and I'm just curious as to what part, is that statutory authority or is that covered under emergency authorities under the declaration of emergency you issued last year?
I'm going to seek clarification on that, but I believe it's through our labor and industry rulemaking process. But I'm not clear right now whether that's under the ambit of my emergency declaration. So I have to get back to you a specific answer to that.
Nick, did you have something you wanted to add there?
Yeah, just quickly building on the governor's remarks. So the state of Washington has a general mask requirement that is governed by gubernatorial proclamation as part of the state of emergency. There's also a Secretary of Health's order that Dr. Shaw has issued that requires the wearing of facial coverings in public places. And it's the combination of these three things plus the business guidance and rules that L&I publishes as part of them that require mask wearing in public places, including in places of business.
Up next, we'll go to Nicole Jennings with Cairo Radio. Go ahead, Nicole.
Hello, Governor. Thank you for taking my question today. Since you've left the masking requirements largely now up to the businesses to decide, I'm wondering, how are you going to help the kids under 12 who can't yet get the vaccine, as well as some of the people who can't get the vaccine for health reasons, as well as these small mom and pop employers who've already had a hard time with the pandemic and now might be thinking, gosh, I'd like to require masks. I would feel safer requiring masks, but maybe somebody will get angry and write a review online. So I guess what recourse do I have? How will you and the state provide a little more help to those businesses who do want to require masks?
Well, the first thing I can do is do everything we can to get more people vaccinated. That's ultimately the answer to this. Everybody's problem here is to get more people vaccinated, because when they're vaccinated, it relieves the pressure on the employers as well. I certainly can provide them moral support, which I'm doing every day, to talk about the advisability of wearing masks if you're not vaccinated. And I'm doing that, which I hope can be somewhat helpful. But I have to tell you, the business people I know are not shrinking violets. They get to make that individual decision for themselves. And I've been pleased to date that there has been a relatively small level of tension associated with these mask mandates. We have had large compliance with the mask mandates, both by the business people and by the consumers. So I think they're perfectly willing. They're not shy violets here. And if they make this decision, it will continue to work as it has worked dramatically. And again, I want to reiterate this. We have been stellar in our performance in the state of Washington. We have saved, probably 15, 17,000 lives in our state because we have followed these mask mandates, because we have people who are common sense, because we have business owners who are willing to follow the law and be honest with their customers about what's safe. So we're not going to just all of a sudden fall over and collapse at this moment. We're going to keep this effort going, and I believe we're going to succeed ultimately.
All right. We've got time for 2 more questions. Sorry, Dr. Shaw, go ahead.
Yeah, Governor, I just was going to add, we've been saying for the last couple of weeks that we want really people to be encouraged to respect the rules of the room. Is the way we've said it, is respect what's happening in that establishment or that local jurisdiction. We at the state are going to be supportive, as you've said, but we really want people to also be very respectful of the rules. If a business is requiring something, they're doing it for a reason. If an establishment is requiring something, they're doing it for a reason. If a local health jurisdiction is requiring something, they're doing it for a reason. We want you to respect those rules, and we really need to continue to be civil about it, and that's what we're really hoping that people do. So it's that moral support, but it's also the encouragement of people to be on their best behaviors as they get into those establishments or those jurisdictions.
All right. Up next, we'll go to Casey Decker with CREM. Go ahead, Casey.
I was curious, for people who either
aren't sure whether they're in the database or probably are not in the database because maybe they got a vaccine in Oregon or Idaho or somewhere else. Is there a way to check whether you're in the database, and is there a way to get your name added to the database if you got a vaccine through a different state or through a federal program that may not already be in the database?
Dr. Shaw, you want to address that?
Yeah, so, you know, the database does not have information for people from other states, and but it, you know, as far as checking, you can, and you know, Lacey, if you could give the information on how to go about checking, but you can go to our system to actually check your information to make sure that you're in the database, and that you can also, by the way, print out the information for having your vaccine record as well through our MyR system. But Lacey, do you want to give the specifics of that?
Yes, you can go to myirmobile.net to look up or check your records. We do want to note that sometimes the matching process will take a few days depending on your name and information. So I want to note that. There also are some tips on our website for other ways you can get your record, and I will put that link in the chat box for you.
Nick, did you have anything you wanted to add there?
Yeah, I just wanted to add that we are doing work with some of these federal agencies that don't report into our database, specifically the VA and DoD. We've been requesting that data for quite a long time. It's something we continue to pursue, and so we are pursuing that as part of our incentive program and plan to do everything we can to address that data gap and if need be, provide an alternative opt-in way for those individuals that got vaccinated through those channels that aren't already in our database.
All right. For our last question, we'll go to Jessamine McIntyre with Q13. Go ahead, Jessamine.
Thank you all, and good afternoon. I actually had a follow-up question, just considering the potential 72-hour lag when people get their vaccination and are entered into the system. When it comes to the different drawings, all the way up to, I guess you would say, July 10th would be the final deadline for a drawing, since it's on July 13th. And also, Governor, when it comes to potentially reopening, when we hit that 72 mark, if it does happen, or 70% mark, if it does happen before June 30th, what will be the amount of time between hitting that number and officially reopening? Is it a few days, or will it happen immediately?
It would be immediately upon our confirmation of the numbers. We'd obviously like to do it as early as possible. You had a question about the deadline. I suspect your numbers sound about right. Is that right, Jasper?
Yeah, so we were not really identifying a cutoff date, which is why we are strongly encouraging folks to get their vaccine early. And the other reason why we have worked with the governor's office to extend this out for 5 weeks, giving people ample time to get their vaccine and get recorded in the system. And so we have pushed out the grand prize to July 13th in hopes that the majority of folks will have had ample opportunity to get their vaccine and get recorded in the IIS.
The other thing I wanted to add, you can call the Vax Help hotline as well to get your Vax records. So the 833 Vax Help, so you can find out if you're in the system there, as well as through myirmobile.net.
Yeah, a couple notes of things to clean up. One is on this federal system of people who are not in the database today. We are working with the federal government to figure out if there is a way to solve that problem so that people who have received a vaccine through the federal channels, Department of Defense, veterans, could opt in to be able to put their name volitionally into the state database. That's not confirmed yet. We hope to be able to work through that. We're working through that. Second, Drew asked a question. There's something I forgot to mention to him about the relationship with the tribes involving the climate change. One of the reasons that I'm confident that in our future work with the tribes is that these bills that have passed have been extremely important to the tribes in so many ways, starting with stopping climate change. They realize that salmon are not going to exist long term unless we stop climate change. The water is getting too hot for salmon to exist. This is a top priority for the tribal community. They also realize that the bills that I signed into law that came into effect only because of another veto I made effectuate about 10% of all the dollars that are generated go to tribal communities, which is extremely important to tribes. And several $100,000 go to trying to develop a protocol that helps the tribal communities. So these bills that were effectuated because of my other vetoes, in fact, have tremendous tribal benefits, not least of which is fighting climate change, which is so important to all of us. And that's why the tribal chairs, just 4 of whom I alluded to, have made clear that they're the spokesman for our tribes, not anyone else, and no one else speaks for them. And they've assured me that we will have robust, meaningful discussions to come up with a workable program of consultation, which is needed by both parties, the state and the tribes. And I'm fully committed to that. And I'm very confident we're going to have success where people work in good faith. With that, good luck in the lottery. This is the most important one you'll ever be in. Thanks.